Hey there, and welcome to another Health Essentials podcast. I'm John Horton, your host. Viagra might qualify as one of the more well-known medications, given its, uplifting abilities. But the little blue pill commonly used for erectile dysfunction may have another power: the prevention and treatment of Alzheimer's disease. Cleveland Clinic-led studies have shown that patients who took sildenafil, more commonly known by the brand name Viagra, were 30% to 54% less likely to be diagnosed with Alzheimer's disease. To learn more about this groundbreaking research, which is still very preliminary, we're joined today by Dr. Feixiong Cheng. Dr. Cheng led the studies and is the founding director of Cleveland Clinic's Genome Center. His research is dedicated to using systems biology to unlock genetic and genomic mysteries influencing health and disease. Now let's find out how his work on Alzheimer's might eventually make a difference in your life or the life of someone you love. Welcome to the podcast, Dr. Cheng. Thanks for stepping away from the lab for a few minutes to talk about your research.
Oh, you're welcome. Very happy to be here.
Well, to get things started, let's spend a few moments just talking about Alzheimer's disease, which has really, I know, been a focus of your work here at Cleveland Clinic. What drove you to study that progressive brain condition?
Oh, of course. So my graduate training background work on like medicinal chemistry, really focus on drug development. And I did a postdoc training across Vanderbilt in Nashville and also Northeastern Harvard Medical School at Boston. Work on the bigger data for, system biology study for drug discovery. So I built my own lab at Cleveland Clinic in 2018.
Wow.
About 7 years ago almost, I chose the Alzheimer's disease as a lab, research area because about a decade ago, my grandpa, father was died by Alzheimer's dementia. So I have, really patient family experience, know how terrible for this disease. So this is why I chose to study this disease about, 7, 8 years ago.
Oh, wow. Yeah. I mean, Alzheimer's is a disease that affects, so many of us through the people in our lives. And that's really something that kind of drove you into trying to find some solutions.
Exactly. I would say Alzheimer's disease, it's not different with other disease. It's not impact for patient only. They also impact the entire patient and the patient family as well. So this is really big health crisis for our, healthcare system, in particular, during the aging populations right now.
Oh, definitely, definitely. So as you start this search and you start looking for solutions for Alzheimer's,
Yes.
how do you end up looking at Viagra? I mean, given what most of us know about the little blue pill, that seems like quite a jump to get there.
Yes, I would say this is I would say long topic. I'm happy to share with you, but it's definitely is a really a teamwork. I'm happy to share with you as well. So we come out of this idea about like 4 and 5 years ago when we started this project. So we learned all current Alzheimer's like a drug development pipeline to see what are the problems we have. And interestingly come to us, for example, Alzheimer's is a really complex disease or multi-factor disease. And people try many ways for therapeutic discovery. For example, people try like a key Alzheimer's protein they call amyloid protein is a hallmark for Alzheimer's. And people try drug discovery couple years, right? The drug success rate is pretty low. Majority clinical trial were failed by anti-amyloid. But the good news, last couple years, 2023 and 2024, two FDA approved anti-amyloid antibody was approved. I think this is really encouraging. And another idea people also try, they call tau protein is another hallmark for Alzheimer's. And people try almost 10 years. And so far, we don't have a success yet. So about 4 and 5 years ago, we, discussed with my, fellows at Cleveland Clinical. We come out a simple idea is we don't want to target the single protein like amyloid and tau protein alone. We come out a more system-based approach or system biology-based approach, target the amyloid and tau protein at the same time, because this is a multi-factor disease, and we propose this idea to the NIH or National Institute on Aging, federal, agency, and we are lucky we get a funding for about 3 to 4 million funding to support to test our idea, and then we come out, Viagra findings.
Yeah. Now, how much of it is related to Viagra just kind of increasing blood flow? Because I know that's kind of what the pill is known to do. Is that something that plays into how it might be sort of a preventative role against Alzheimer's?
I think so. So what we did, in our project is we use the big data approach to screening all like 1,600 FDA approved drug. But surprisingly, the Viagra or sildenafil come out very top, even in our top 10 predicted drugs. And then based on your explanation, we see Viagra also increase the blood flow, and people see neuroprotective effect for other disease. This is why we choose Viagra for our further
Well,
study.
and it seems like that's pretty common, right? Where there's a medication that's used for one thing, and we kind of start looking at it in a different way and find it might have more applications.
Exactly. And this type of idea people call drug repositioning. So I tried the drug repositioning project for multiple disease beyond Alzheimer's, almost like 15 years right now. And we identify multiple drug candidate. But I'm very excited about this story like Viagra and sildenafil we discovered about, you know, we published in 2021 about 3 years ago, in Nature Agents.
Now, from your research so far, how effective might sildenafil be against Alzheimer's?
Yeah, this is a really good question. So far, for Alzheimer's drug discovery, we don't have good model to test this kind of idea. So what we did in our project is we use the largest scale retrospective patient data analysis. For example, we use the health insurance claims data. When patients see doctor and the doctor send this kind of information to health insurance company, and the insurance company have this kind of claims data for millions or even hundreds of millions of patients. So we use this big data. We found interesting is if people take a Viagra, compare people don't take a Viagra, have a similar age, have a similar male and a female, and also have similar disease burden. We found if people take a Viagra, is associated with a reduce about 30 to 50% risk of Alzheimer's compared to patients that don't take a Viagra.
That's really incredible, and I mean, and just potentially just groundbreaking. If taking that can somehow offer a little bit of a protective effect against kind of the onset of Alzheimer's.
Yeah, but I have to share with you or even in this audience as well is our study is still retrospective analysis. It's not a clinical trial. So this 30 to 50% reduction may also driven by possible confounding factor as well. We must be verified in the clinical trial, like a randomized clinical trial, to further to confirm the benefit for patients.
Right. So it sounds like what you found was when you looked at all these different cases
Mhm.
with people who have taken Viagra, there was just kind of, I don't want to say coincidentally, but they also had a lower percentage of Alzheimer's. So now it's a matter of digging in to see whether it's truly
Yeah.
related or if there's a bunch of other factors driving that.
Yes.
How might Viagra work to guard against Alzheimer's? When I was reading some of the studies, there were things about protein clumps and neurons, and there
Okay.
was a whole lot going on there. So can you break it down for us a little?
No problem, right? I would say, like I mentioned before, the Alzheimer's is really multi-factor or complex disease. And Viagra, I would say, is also magic drug as well. They also have multi-factor effect in our human body as well. Beyond just increase the blood flow in our human brain may have protective effect for Alzheimer's. In our basic research, we also show that, for example, we use the patient stem cell, they call iPS cell, we can derive to the neuron, use this kind of technology to get a Nobel Prize 2016. And what we found is Viagra treatment, this iPSC-derived neuron, they have a neuroprotective effect we show. And they also can reduce like a key Alzheimer's hallmark, like the tau protein, like a phosphate tau protein. I apologize for this kind of research term, right?
No, that's good.
Yeah,
No, but that's what we're trying to get into. So it sounds like it kind of it changes some things a little bit within you to kind of maybe slow the progression or kind of prevent it um, from happening.
exactly. Beyond just our common knowledge about increase the blood flow, we also show in our basic research mechanistically, Viagra also can targeting the Alzheimer's biology. For example, neuroprotective effect, we see neurotype growth, also reduce the tau hallmark protein phosphorylation as well, really support the benefit we see in the retrospective patient data analysis as well.
It sounds like it's so hard to try to narrow down what causes Alzheimer's because, like you said, it's multifactorial. There's so many things playing into it.
Yeah.
But it sounds like from what your research has shown, Viagra kind of it starts getting into those neurons and just the chemistry inside you, and what it's doing is kind of tamping down some of the forces that might lead to Alzheimer's development.
Exactly. This is the beauty for drug repositioning. We just discussed it before. Viagra is a drug originally developed for erectile dysfunction, but they also have other multi-factor effect like we discussed, and then this can be used for Alzheimer's as well. We see many other examples for other type disease as well.
Well, and I think as we talked about earlier, I mean, Viagra didn't start as an erectile dysfunction drug. I think it started as a heart medication, right?
Yes.
So it's already been reused. So
Exactly.
So when we start looking at possibly using Viagra to help prevent Alzheimer's, or if that's possible in the future, would this be a treatment that would be possible for men and women?
Oh yeah, this is really good question. So in our original study, we only show very strong reduction effect in men because Viagra originally approved for erectile dysfunction, but Viagra also off-label use for pulmonary hypertension as well. It's
Okay.
also FDA approved. So in pulmonary hypertension patient, we also have a small number of women as well. In our original study, we also see Viagra also with a reduced Alzheimer's in women, but no statistical significance because the small population for women. Yeah.
So it sounds like you saw some of that. It may have some protective effects, but it's a much smaller sample size, so it's hard to draw a lot of conclusions from it.
Yeah, but in our new publication we just published in 2024, we looked at both like a men and a woman, iPS cell, this stem cell derived from both men and a woman, and then we see the similar effect as well. In our like animal study, we didn't publish yet. We look at both male and female mice, Alzheimer's disease mice, we see the same effect as well. But we need to further confirm in the future, like a clinical trial study.
As we talked about, when we talked the other day, and there's still a lot of research to do, but it does seem like everything that we're finding it's in the direction we want it to go. It's just now a matter of kind of making sure and verifying, dotting the I's and crossing the T's, I guess, as the phrase goes. So I have to tell you, it's fascinating to think that a drug originally designed for a completely different purpose might have such potential for Alzheimer's. As we start looking at this, though, are there also some like risks or side effects associated with Viagra and maybe using it this way?
Yes. So I would say overall, Viagra is a pretty safe drug for healthy people, but we need to still be careful about a potential side effect for some people if they have underlying condition. For example, if some individuals they have a cardiovascular problem like a low blood pressure, Viagra still can cause low blood pressure as well, have potential side effect, or have potential adverse drug interaction if you take other drug together. So this is something you need to be careful. You have to to consulting with your primary doctor as well, about this kind of potential side effect.
And I have to ask too,
Sure.
given that Viagra is obviously more commonly known for what it can do with
Mhm.
maintaining erections, is that also a potential side effect that could come if you're taking this for Alzheimer's?
I think so. I would say, for Alzheimer's patient, we need to more be careful because Alzheimer's patient overall is pretty sick and is also older individuals. They have more like a disease comorbidities, like a cardiovascular problem, hypertension problem. When you take a Viagra, you need to very be careful because most old Alzheimer's, individuals, they take multiple drug at the same day. So when you take this type of drug, in the future, very, very be careful, as well.
Yeah, and that's what's got to be hard with trying to figure this out because, as I understand it now, it's not like Viagra is something you take like daily, like every morning with breakfast. It's something you're taking for a certain occasion for a lot of people.
Yeah.
And so I guess, yeah, trying to narrow down how you would use it with Alzheimer's, if you make it a regular thing or a smaller dose, maybe you get some of those protective effects. I'm guessing those are all things that you're kind of looking at with your research.
Exactly. This is something, we work very hard with our Cleveland clinical physicians, right? Try to conduct the clinical trial right now. We are really active work on that in the past 2 years to design our clinical trial in more rational way, include the dosage, include the frequency, because Alzheimer's patients, they have dementia, they cannot take a drug multiple times per day. We only try once or twice per day as well to help this particular disease population.
Now, when you're looking at this, I know a lot of the research has kind of shown that people who took it were less likely to have Alzheimer's. So, are we looking at this more as maybe a potential preventative medication, or is there hope that could also be used maybe for treatment once you have it to maybe slow the progression of the disease?
Oh, this is really good question. I think our current, research cannot, really determine is the prevention and treatment or disease modifying or treatment right now. But our data is more support, preventive effect in the current stage. For the treatment effect, we have more research to be done, in particularly, clinical trial, like a randomized clinical trial to be done to see the possible delay the progression in the future.
Well, I guess the good news is if you prevent it from coming on, maybe you're not going to need as much treatment. So that would be a good thing.
But yeah, this is good sense. I agree for our healthcare system. But today, even in our United States, we still have 6 million Alzheimer's patients we need to treat as well.
Yes, yes.
Yeah.
So it seems that like we've seen some promise when it
Mhm.
comes to Viagra, possibly protecting against
Mhm.
Alzheimer's. How far might we be where the research may actually allow Viagra to be prescribed to prevent Alzheimer's in some way?
Oh yeah, this is a good question, and this is really dependent on the process for our clinical trial, study we work on. I really hope beyond us, many maybe other physicians also can testing Viagra in the patient in other clinical trials together as well. So about the possible timeline, we are conducting the possible phase 2 trial to test Viagra. Usually it will take like 2 or 3 years. We will get the preliminary results to see the possible effect. If you're really waiting for final phase 3 trial, may take longer. I cannot give exactly timeline right now. It will take years before we can come. I hope you understand that this is how complexity for the research we work on right now.
Yeah, it
Yeah.
sounds like there's a lot to do. So the bottom line is nobody's going to be able to go into their doctor tomorrow and ask
Yeah.
for a Viagra prescription for Alzheimer's. They're gonna have to show a little patience and see where this research goes.
Yeah, exactly. So what we work on right now is really active, get the federal funding or even other type, funding support for this, clinical trial get started. When we get this clinical trial started, the patient can be enrolled in our clinical trial to receive this drug as well to see the possible effect.
Well, I have to tell you, Dr. Cheng, this has been a fascinating
Thank
discussion
you.
and
Yeah.
one that I'm sure kind of offers some hope for many, many people. So I want to say thank you for the work that you and your team have done on this so far to maybe kind of crack the code and maybe stop, or prevent Alzheimer's. Um, Before we kind of part ways, though, and you go back to your lab to do all this important work, do you have any advice or just words of encouragement to share with anyone who's dealing with Alzheimer's?
Oh, of course. So I would say Viagra just the one type, example or research project we work on in the lab, supported by federal funding or our institute. We work on many other, type of therapeutics we work on right now. Hopefully, we can publish these results. Another, news I want to share to the Alzheimer's, community as well. They have multiple, drug, people testing in phase 3 trial as well. We really hope next few years some drug really show the real effect in future and get FDA approved as well. But I really wanted to share to the Alzheimer's patient or patient family as well. Alzheimer's is complex disease beyond treatment. You mentioned before. I think prevention is still the good strategy right now. For example, beyond just Viagra we discussed, if we can control the BMI very well, keep the healthy diet, sleep very well, control your blood pressure and cholesterol very well, this is all risk factor for Alzheimer's, and you are very likely to reduce your likelihood to get Alzheimer's in the future as well. I really encourage our community to take this kind of small step, to help to prevent even ourselves, for potential Alzheimer's in the future as well.
Yeah, it does sound like with so many things that we talk
Yeah,
about on this podcast, if you lead a healthy life with a
yeah,
healthy diet and exercise and get enough sleep, it seems like your chances are so much better to avoid some of these diseases that we all kind of fear.
yeah. I totally agree.
All right. Well, Dr. Cheng, once again, thank you so much for
You're
taking some
welcome.
time to talk with us today. And again, thank you for all the work and research that you are doing. I look forward to having you back on to talk when this is, when we can give 2 thumbs up that this is ready to go.
Thank you so much. If we get a clinical trial research done in the future, we're happy to talk with you further.
Thanks a lot. Have a great day.
Thank you. Bye-bye.
Alzheimer's disease currently affects over 6 million Americans, and that number is expected to triple in the next 25 years. It's clear there's a need for prevention strategies, and studies suggest that Viagra could possibly fill that role. Stay tuned as Dr. Cheng and his fellow researchers continue their work to see if it's a viable solution. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.